Hello, this is Barbara from the Department of Medicaid Services. It is 9:59 and I'm still clearing the waiting room.
Thank you.
So it's 10:01 and I still have a few more coming in, but it looks like it's just John and Brandon that are on at the moment.
We'll give it a few more minutes if you don't mind.
Okay. Okay, John, it is 10:02 and currently it's yourself, Brandon, and Barry that are on.
I'm here.
Okay. Morning, Barry.
Hey, good morning.
Okay. Well, we're going to get started then.
Morning, everyone.
Well, yeah, it's just the three of us looks like, so we don't have quorum. Is anyone else in the waiting room?
I do not see anybody in the waiting room.
Oh,
You have 3 out of 5.
yeah.
Who else do we have? Patrick and who else?
Three out of 5 is a quorum.
Yes.
Oh, okay.
Oh, we
Yes,
have,
you're
yes, we
good.
did. I'm
Yes,
sorry.
you're good to go.
You said Brandon, I'm sorry.
Yep.
I apologize.
Good morning.
Morning, Brandon.
Brandon.
Good morning.
Okay, so we've established quorum. Good morning, everyone. If I did not greet everyone this morning, we've established quorum. The prior TAC minutes, TAC meeting minutes, has everyone had an opportunity to read those?
Yes. I'm
Yes.
And, okay,
accept
good.
and submit it.
Any
I second.
corrections or changes?
We're ahead of
No.
you, John.
I know.
Sorry.
We've only had 3 sips of coffee this morning. Can we have a motion to, well, you already did that, okay. I'm behind, guys, sorry.
That's all right.
Then let's move on to old business. We have updates on recommendations to MAC.
So this is Barbara from the Department of Medicaid Services again, and we the new MAC meeting will be taking place on November 3rd, so that recommendations will be presented then.
Okay,
Okay,
okay, thank you.
you're welcome.
You know, with the new arrangement, I wasn't quite sure how that was gonna work myself, so thank you for that. Okay, then moving on to new business, KPCA representative updates.
Morning. This is Chuck O'Neill for KPCA. And so we've got on the agenda, Mr. Chair, presentation and support of standardized operations for all MCOs and PTAC recommendations to the MAC. I think we covered that in its entirety at the last meeting and got a motion through. So I think those were probably just replicated from last month, unless there's any questions on those recommendations. I think the plan is for those to be presented at the next MAC on November 3rd.
Okay, sounds good. Thank you, Chuck. Appreciate that. And I believe I saw you send those out a couple of days ago.
Yes,
Did I
sir.
see any emails? Okay, good.
Yes,
Thank
sir.
you. Appreciate it.
Absolutely.
DMS updates. We have an update from DMS on the 1115 waiver application.
This is
Barbara, is
Karen.
anybody
I'm
here
looking
from,
to see who's on that might be
I
able
think
to assist in that.
I think Jonathan Scott is on. There you go, Jonathan.
Good morning, everyone. I'm actually not here to talk about the 1115 waiver application, though. So that's why I had not hopped on just yet. So if you all, so if anybody wants to do that after this, I have a really brief update on the federal changes that I can go over with you, if you want to
Please.
sort of switch those two. All right.
Thank
So the big federal issue, there's a couple of large federal deadlines and issues going on. So just going to briefly touch on those. So first of all, the shutdown, wanted to reemphasize this currently doesn't impact Medicaid. So members should continue to use their benefits. Providers should continue to submit claims, and they should continue to be paid for claims. So if you have any information that that is not happening and it is being contributed to the current shutdown, please walk those up to the department. We'd be happy to take action on that and monitor it a little bit more closely. Do you all have any questions about the shutdown while we were touching on this topic?
I do not, unless someone on the meeting would like to ask a question.
I don't have any questions about it.
And then the next kind of major pending issue is the Rural Health Transformation Initiative. If you've heard a little bit about that, that was a piece of the HR1, and that's something that a lot of the it's being addressed by CHFS. We have to submit a proposal by the 5th of November. That is, we're currently in the process of getting all of that together. I say we, it's a cabinet-wide initiative that is being undertaken by cabinet leadership. So the DMS is contributing, providing expertise in Medicaid areas if they do come up in that situation, which is going to be a broader health initiative. This was addressed yesterday in the MOAB meeting. If you saw Secretary Stack talking about it, he highlighted there's going to be a menu of ideas that will be addressed in our rural health transformation application: maternal health, oral health, behavioral health. There's going to be a lot of there's going to be a focus on rural EMS services. Of course, the provider workforce is always an issue in rural health, and then there's going to be some healthier population initiatives such as chronic disease management that will be included in there as well. It's going to be consistent with what we understand will be the other initiatives from other states as well. Large number of stakeholders and individuals who have agreed to sign on to specific initiatives that will be part of our application that will be submitted. So there will be letters of support and lots of individuals who will be hoping to help and planning to assist as that initiative and those funds are utilized over the next couple of years. CHFS is planning to submit early. There's been issues with the federal data systems, so they will be submitted probably November 3rd, around then. That's I thought an interesting note that he had there was that we are the 10th most rural state in the U.S. So we certainly hope that our participation, the level to which we are considered in that program is going to be reflective of our rural status. 41% of our population lives in a rural county, so that's going to be something significant. Hopefully as it goes forward. If you have any questions, I'll do my best. Again, want to point out that I can't make an official statement on behalf of CHFS. This is a cabinet-wide initiative. So,
Hey, Jonathan, I have to say that you definitely you put the money grab in the most tactful manner that you could put it in.
That was pretty smooth.
That was really smooth. I have to say that.
Thank you.
Thank you, Jonathan. Appreciate it.
No problem.
Do we have anyone on that can discuss the waiver, or should you just pass on that? I'm hearing silence, so we'll move on. Let's see. Let's see. The next item, I think I got a note that Connie White would not be here. Is there anyone here to cover the PH updates? Or is she the only one going to do that?
I was advised that someone was going to come in her place, but no one seems to be stepping up.
Okay. Okay. Well, I don't want to waste you guys' valuable time. Let's move on then to DBH DID representative updates.
Good morning. My name's Ann Holland. I'm an executive advisor within the Department for Behavioral Health, Developmental, and Intellectual Disabilities. And Commissioner Marks is got laryngitis, so I'm going to give our updates for us today. First, I want to start with, I think I came and gave a presentation on the 1915 I Rise initiative, maybe a couple of meetings ago. I just wanted to give an update of where we are. Currently, we are focusing on still getting providers in and getting them certified and enrolled. We have so far, we're working currently with 3 providers in their initial review process of their certification application. We have 4 providers in formal review, and we are currently doing pre-service site visits for 5 providers. I also wanted to let this group know that we have ongoing office hours, Mondays and Wednesdays from 3 to 4. We have a link on our website. I will throw that in the chat when I finish giving updates. For any provider that has questions about the process or a question about what we're asking for, our staff are on there to answer those questions, and we also give some just general information as well. And then the other item I wanted to discuss is, excuse me, sorry, is our initiative with ZIA partners on building our co-occurring capabilities. The Building Our Co-occurring Capabilities initiative is a collaborative between DBHDID, ZIA partners, and providers across Kentucky to enhance our ability as systems and providers to meet the complex needs of individuals, families, and communities we serve. DBHDID is starting by addressing the complexities of co-occurring mental health and substance use and recognizes other issues are often present that will need attention. We seek to, DBHDID seeks to live out our role of being in and supporting others to be in the hope business, every person, including those with the greatest challenges, is inspired when they meet us with hope for achieving a happy, hopeful, productive, and meaningful life. This means all services are in every way hopeful, person or family driven, empowering, and strength based, and designed to help people achieve their most important and meaningful goals. We are looking to improve what we already do and are committed to doing it better. What does this look like? All programs in our system become welcoming, hopeful, and strength-based. So recovery oriented, resiliency oriented, trauma informed, and co-occurring capable. All persons delivering care become welcoming, hopeful, strength-based, trauma informed, and co-occurring competent. So why should we do this? We all know that complexity in the expectation is the expectation, not the exception. The majority of people seeking support, services, resources, and information have multiple needs: mental health, substance use, mental health and intellectual disability, substance use, developmental disability, and underlying or concurrent trauma, etc. Unfortunately, our systems are not set up to be able to respond to all those needs well. Rather than wait until the systems can be overhauled, this initiative allows us to improve our capabilities to meet complex needs right now. We know that increasing our capability to address co-occurring needs will improve outcomes for those we serve, reduce the number of revolving doors clients have to go through, enhance community well-being, and benefit our staff and their well-being. A few things to know: this is not co-locating multiple services in the same location. This is not having everyone become dual licensed. This is not making more referrals, and it's not waiting until payers will approve co-occurring billing codes. This is rethinking and changing how we do what we do best: serve the complex needs of the individuals, the families, and communities who walk through and live outside our doors. So that's just I think our ZIA partners have reached out to several providers, and we have been working with them and getting this word out. So that's the update from DBHDID.
Thank you very much, Ann. Appreciate that.
And I'll put the 1959 Rise website in the chat.
Okay, thank you. Appreciate it. Thank you much. Do we have any other business from the committee members this morning?
Hey, John, I just looked at the email that we got, and Connie nor no one from DPH will be here.
Okay,
So,
thank you, Barry, for checking that.
all right.
Do we have any other business to discuss this morning?
Mr. Chair, I have a question for DMS, if that would be possible.
Yes, please.
Thank you. So we're in a situation, CMS requires that value-based contracts be executed prior to the start of the performance year. And the MCOs are reporting to us they're currently waiting on the quality program measures to be released by DMS. So we were just going to ask the staff if there was an estimated release date on those measures, as the contracting process requires a significant amount of time and coordination. And the longer we wait, the greater the pressure will be to complete contracts in a limited within a limited time frame.
Hello, this is Angie Parker with
Hi, Angie.
Medicaid. We are finalizing those measures this week. We hope to have that out by next week.
That's wonderful. Thank you. Appreciate
There's
that.
not a lot of significant changes. There are some, there are a couple that are added, and some may be switched from a bonus to a core, but we are finalizing that this week, and notification will be sent next week.
Thank you. Thank you, Mr. Chair.
Thank you for that, Angie. Let's see, any other business? Okay, hearing none, may we have a motion to adjourn?
This Brandon, I so move.
I'll second that.
Okay. All those in favor?
Aye.
Aye.
Okay. Thank you all very much for your time this morning. Appreciate it.
Hey, thank you all. Have a good day.
Have a great day.
Thank you, guys.
Thank you.